All right, guys, now we get to dive into optic nerve. Guys, this section is going to be short and sweet. I'm going to kind of tie in the key points about the optic nerve I want you to know. And one of the things I just want to point out before we get rocking and rolling is the meninges. Do you guys remember meninges? Remember what that is? It's pia mater, arachnoid mater, and dura mater. If they ask you on boards, where did the meninges start? Where do they start at in the course of the optic nerve? You're going to know it's right at the lamina cribrosa. If I asked you what else starts at the lamina cribrosa, many of you guys would say, ding, 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 myelination. You know that it's not normal for the nerve fiber layer to be myelinated. You know that myelination starts at the lamina cribrosa. So when you picture the lamina, picture two critical things happen there. That's where you get your meninges. That's where you get myelination. The other thing I want to point out, guys, is once you hit lamina cribrosa, okay, once you hit from that moment back, that's called the intraorbital portion of the optic nerve, okay? And that makes for a great region of test questions. I'm going to point that out in just a second. Before I do that with the visual, I want to ask you a question. If I said to you, what are the meninges? You'd say pia, arachnoid, and dura. And if I said, what is the subarachnoid space? Where is that located? You would say it's in between what? The pia and arachnoid, right there, okay? And why is that important? So if you had to write that out, write out PAD, P-A-D, okay? Right in between pia and arachnoid, that is the subarachnoid space. Why is that important? Because that's where CSF runs, cerebral spinal fluid, right? And if they ask you on boards, where is the cerebral spinal fluid made? You would say in the ventricles. And if they asked you what within the ventricles makes that CSF, you would say the choroid plexus, okay? So that's important context to know. I know you can see and read some of that in your text, but that's some details that aren't in there that I wanted to pull in. But now I want to draw you a quick sketch of the regions of the optic nerve, show you some good test questions that could come from it. Okay, guys, if this is the orbit right in here, okay, and this is your eyeball here, okay, and your optic nerve, it's like you're looking at the front of the optic nerve right there, you're grading the CD ratio, right, and then right behind the optic nerve we said is a pivotal moment right here. I'm going to put it in green. That is the lamina cribrosa, okay? The big thing I want you to understand is that the lamina cribrosa is a key point for two M things, myelination and meninges. And so you want to know that the optic nerve is S-shaped until it exits back here, and you guys know it exits the lesser wing, right? So this is the lesser wing right there, and the lesser wing has a hole in it, okay? And that's called the optic canal, right? You might remember the optic canal is in the lesser wing. So if they ask you, pretty much a lot of the great test questions are going to come from this region of the optic nerve, which is the intraorbital portion. The fact it's 30 millimeters long, right? The fact it's the longest portion of the optic nerve, that it has meninges, that it has myelination, that it's S-shaped, that this is a location where if a patient has optic neuritis, they're going to have pain on eye movement, is because of this S-shaped portion of the nerve, okay? So again, this portion right here in front of the lamina cribrosa is going to be called the intraoptic portion of the cranial nerve, okay? Intraocular portion. That intraocular portion is 1 millimeter in length, right there, that's it, until it hits the lamina cribrosa, which is right there. And then everything behind that, again, is going to be intraorbital, which again is 30 millimeters in length until it exits the optic canal right there, okay? So those are some key things I would pay attention to. The other thing I would kind of ask you to look at carefully is what provides the myelination back here. Okay, if they ask you, you have two choices really. It's Schwann cells or oligodendrocytes. And all of you guys are saying oligodendrocytes are found in the central nervous system. The eye is in the CNS, so it's going to be that. Oligodendrocytes would be the answer, okay? Remember the eye, in terms of embryology, while we're at it, let's just hit this. The eye is going to be an outgrowth of the diencephalon, remember, if they asked you on boards, okay? So guys, that's it. I just wanted to pound through and give you a quick sketch of the key points of the optic nerve, okay? And the other thing I would point out is what's providing blood supply to this portion right there of the optic nerve, the optic disc. You guys remember? That's the SPCA, which is the circle of Zinn-Haller. Good, okay? That's the other thing I would pay attention to if they want to get picky and ask about blood supply. Okay, and that's it for now, guys. I'm going to jump into visual pathway, and we'll hit cranial nerve 2 again from a little different angle in a minute, but that's the regions of the optic nerve right there.